So then we get into more of the circus specific things. So looking at hanging alignment. So seeing what sort of their natural position. We see a mix of things. Sometimes people are taught to depress the scapula too much when they engage. We'll see where the humerus internally rotates too much. And here from the back is a nice view too. You can look at those creases just like we'd look for hinging in other places. And and it's a little hard to see from this distance, but like that depth of the creases is deeper on that left side. So again, showing that humeral head tracking forward.
One of the advantages with your higher end circus artists, their surface anatomy is pretty good.
Yes, yeah. And then again, we can look from the front and look more at like, do we see that humeral head forward in the axilla too? And so I would start with just straight hanging. I might start with some small, what we'd call mini beats, where they're bringing the legs forward and back, and just look at their stability here, and then looking at more. It would be considered basic in circus, but sort of a fundamental movement. But it's simple enough that I can see what's happening at the shoulder. So.
And are you asking for feedback here as well at this point? Do you engage them saying, how does that feel? Does it feel stable? Do you feel like you're slipping? Does it feel like it's going to
absolutely.
Does it feel different left to right?
And I would use that because I might not go into this depending on how symptomatic they are. Yeah, great point. So seeing, does it reproduce the symptoms that they're having?
Yep.
And then often as I examine, I'm also going to play with some correction if I can and see if they have enough motor control to activate and center that humeral head. Does that make it feel better?
Okay.
And that can really help guide treatment. So moving into intervention things. So if they have any mobility restrictions, so we talked about pec minor, posterior cuff, I might address those things. A lot of motor control, teaching them, they've got that passive laxity, but can they get some more dynamic stability? Centering the humeral head, and often that's activating the rotator cuff, and also just sort of positional awareness and teaching them to do it first in really simple movements and then gradually into their circus-specific movements.
What sort of cueing do you use here? How do you help them? Because they're different learners sometimes, aren't they?
Yeah. So I'll show you a few different things that I use as we get into the training. Okay. And so, you might also have just some strengthening to address with this, in addition to the motor control, and then, of course, getting back into training. So here's an example of where I might start, especially if they've got those this excessive mobility into external rotation and limited internal, just doing some active range of motion with that rotation. I might try to loosen up the internal a little bit. Often that helps them sit better. Mm-hmm. And so here I've got my back of my hand behind the humeral head, cueing them to draw that back and to center it. Mm-hmm. And then they can use the table. And I have a towel under the elbow because I don't want them their arm behind their body. That's also going to slide the humeral head forward. And so a progression and also a strengthening thing for subscap would be adding weight and maintaining that centration. So real simple thing to start with. Yeah. But often you do need to back up and start with these really simple things in my experience.
What sort of weight do you generally start with? I know it varies from sort of person to person, but...
Yeah, low weights might be just a pound or two with this, it depending on what their muscle tests look like and just how well they're able to learn. But often it's very light. Yeah. And if you think about what they're doing, obviously they're taking bigger loads when they're in the air. So
I think just to jump in for a tick, I think this is one of the key things of working with circus artists is taking the time to explain to them why you're doing it, because for them to be able to extrapolate why they're doing that exercise when they do this hanging trick up in the air. It's like making them make that link.
Yeah, education is a huge part of this, right? So how does that affect them when they're doing those dynamics? And so here looking at mid and low traps. So I'm using here a technique that starts with, comes from the dynamic neuromuscular stabilization or DNS stuff. So to get that low trap activation of pushing the elbow down, opening the fingers and extending the wrist, even before lifting for someone that really can't find those muscles, that can be a nice way to activate.
Talk to me about the fingers.
So a lot of their stuff comes from sort of it's child development and reflexive patterns. And so that's one of the patterns that they found will activate those scapular stabilizers. And so it's a nice little trick if people aren't finding it. Yeah. And so I don't have to start everybody there, but someone who really doesn't know how to find those muscles, it's a nice thing. So this is, just looking at a progression, starting with the elbow flex, going from what I would call a W to a diamond position. So there's me cueing the elbow and the hand and then lifting off here, and cueing that slide of the scapula on the rib cage as opposed to just bringing the humerus back also.
Nice.
And then taking this up overhead. But one of the nice things of this example, it kind of shows like the errors that happen with learning too. Like, you get one that looks good and then you get one that looks really messy. And so, there's repetitions of practice to get this down. So this is the one that looks a bit messier here. So that sort of drawing back and that sort of compensation down and back and then dropping the elbow. Progression here would be like just straightening the arms, so taking a bigger load and being able to maintain all those mechanics. Yeah. And I like to really have people in external rotation to also keep the upper trap a little quieter with that. So then, a lot of us have been taught and give internal external rotation down in neutral, right? That's kind of a standard of rehab, but these folks really need to strengthen in the higher ranges. So this one is one I like half kneeling. It's a little bit more unstable, brings in a little bit more trunk. And then that starting at 90 degrees, external rotation and punching overhead. So you get that activation of the posterior cuff through that range. And then you can integrate more muscles if you're doing it with this PNF type pattern. So starting, reaching into a diagonal type pattern, and you're also going to get activation of those muscles, but more bringing in other muscles in the chain and less isolated. So that can be a nice progression as well.
Yeah, it really demands that core stability playing its role, doesn't it?
Yeah, absolutely. And then if we get into motor control and hanging, so classically airlifts get taught to depress their shoulders. It's called a shoulder shrug as a warm-up to engage. And I like to really get people, especially my hypermobile people, but other people too, out of this habit and just taking their scapula into a circle. And I might start with like depression and then protraction and then elevation and then retraction. Okay. And de-emphasizing end range depression when the arm is overhead, because that's really bringing that acromion down onto the rotator cuff.